Hi, everyone. My name is John Faulkner, and I'm the host of the Smarter Systems Better Care podcast. And I'm here today with Binta Patel. She is the CEO of Zen Medical Services, where they empower medical practices to thrive by streamlining revenue, medical management, and then also ensuring providers can focus on what matters most, exceptional patient care. So thank you for joining us today, Binta. Appreciate your time.
Thank you, John. Glad to be here.
Could you tell us a bit about your background, your business model, and just some of the clients that you serve?
Definitely, John. So we have been in business for 13 years now. I started this when my son was just born and wanted to look into a space that allows me to have flexibility, at the same time, something of my own with my MBA and other background. So it was started 13 years back. I am a certified professional biller, certified professional coder. I got all that. And then we started, and now we are in almost 20 states in the nation. We have 40 practices, mid-sized practices that we serve today. And on an average, we process close to 10 million in revenue for our providers.
Excellent. So you had it sounds like pretty amazing results working with your clients. So that's fantastic.
Absolutely.
What's like the core focus of your business today, and like what role are you playing in kind of driving that growth within your business?
So right now, our core focus is around ambulatory surgical centers, also mid-size practices. When we say mid-size, anywhere from 1 to 10 providers. And we help many specialties, but our core focus is around cardiology, ophthalmology, gastroenterology, and OBGYN. These are the 4 areas along with the ASCs that we focus on.
Excellent. So you've got a really niche market and what you're focusing on as far as service lines. So that's great. And then if you had to like give like a 30-second pitch, on your competitive edge, like why you're different than other similar companies, what would it be?
Great question, John. How do we differentiate from others? Well, we provide very personalized services. We work with our clients on a very personal basis. Our services, what we really pride in ourselves is we help collect money on almost 95 to 98% of the claims, which is very tough in this market and changing scenarios. Most of the competitors and people with providers with billers in their own office, usually collections is about 85%. But we go that extra mile and we help almost all of our practices collect close to 95 to 98% on the number of claims we submit. So that is what we.
Yeah, that sounds like how you differentiate yourself. What is, for those that may not know, what's the comparison percentage to other similar businesses? Is it like lower 90s, or where are they usually hitting?
Usually, typically industry standard is close to 85 to 90.
Okay.
And now with changing landscape, it's getting even lower.
Okay. So that could be kind of changing, like, how things are shifting in the industry too, from what you're probably seeing as well.
Absolutely. Yes.
Yeah. And then like, what's one shift right now that you're seeing that most like founders or operators of their businesses in similar businesses like your own may be underestimating? Is there anything specific that comes to mind?
Absolutely. And in fact, it's a couple of things. I would not just say one. One of the major challenge or shift in the industry is overall payments from our federal systems like Medicare, Medical, and of course Medicaid. Over the last 5 years, John, the payment have been reducing. So the conversion factor to which you applied your relative value, that has gone down 7% in last 5 years. That means 7% reduction in overall payment to all our providers. And in just 1 year from 24 to 25, that is 2.86%. So with everything same, your payment has reduced significantly. And of course, your cost is going up. Inflation is going up. So with the less amount of money, now you have to provide the same set of services, which is one of the major challenge in this industry. And not just that, I mean, another thing that we see now more and more is a patient portion. The patient responsibility is going up year over year, right? Whether it's deductible or co-insurance or co-pays, patient responsibility has shot up significantly based on the plans that people have. So collecting from patients is another item that providers need to tightly focus. And I know you just asked me one, but I have to tell you all these three.
Yeah, go for it.
Third one is payers themselves, right? Payers have stringent guidelines in terms of paying to the providers. timely filing limit, the time that you have to file a claim, has substantially reduced. Earlier, it used to be year, 6 months. Now, majority of the payer, you only have 3 months to submit a claim. So if
Yeah.
you are behind, you have submitted and claim didn't make it, you have short time to get the payments. And then there are many more, but these are the trends that we are seeing in this industry, which allows medical providers to get payment. Yeah, I mean, it's a tough for people to get paid.
Yeah, it sounds like it. And I imagine you're probably going to practices sometimes where they may be months or even worse, years behind. So I can't imagine trying to catch that up for them. But I can envision the relief that they probably have off their shoulders once they get caught up. It probably makes them feel so much better.
In fact, I can, John, tell you a story of
Yeah.
one of our provider who, this is back in 2021. When
Yeah.
they came to us, it was a two provider practice, family physician practice. They had more than 50% of claims in backlog. That means they were not paid on 50% of their claims.
Wow.
They were sitting 90 to 120 days apart, and they had cash flow constraints. The owner himself was not a medical practitioner, so he was running the business and he had tough time making ends meet. So when we started working with them, we were able to not just clean up the AR, but streamline their processes. First year, we bumped the revenue by 30% itself.
Wow.
And
It's
then
amazing.
from second year onward, we were able to almost double the revenue because not just by adding a provider, but helping them suggest services that our other providers were using, like chronic care management, remote patient monitoring. And now they are thriving, practice is growing and overall the business is running well. So it's all about how you streamline your overall office and processes to collect on 95 to 98% of the claims.
Yeah. Getting those systems in place so they feel like they can focus more on the patients. So exactly what you're trying to do. So that's amazing. That's a transformational experience. It sounds like those particular providers went through, both of them, right? And then like, how do you see the industry adapting to like these more stringent measures from payers? What adaptations have you seen?
Uh, Great question, John. So, yes, I mean, practices are realizing that collecting efficiently is very important. And that's why practices are putting more focus, more attention towards streamlining processes, reaching out for help. I have seen many practices coming to us just for consultation, right? Even a free consultation to where a third party comes and audits your system and tells you what's working, what's not working, where your revenue is stuck, right? How can
Yeah.
you maximize? So I think providers are aware with increasing cost, there is no way out, right? They have to look at how they can maximize on what, they are making. So there is that awareness, which is a great thing.
Yeah. Being aware of kind of like what's going on and, a crude way of saying it, I feel like you're not drowning, right? In like what's
Yes.
happening. So, yeah. So how are what are you seeing your peers do to kind of stay ahead of this? Because we kind of talked about like industry at large, but are there specific peers that are taking certain specific actions that you've seen? Or are they kind of just hoping things get better, I guess, with the current market?
As it relates to our peers, absolutely everybody is becoming more and more diligent towards streamlining the processes, streamlining the overall operations to how they can get people, get the medical professionals paid more. Another trend that we are seeing and actually we have started implementing is along with automation, right? I mean, everyone going towards automation. This is another area where how do you automate the manual processes that you are doing today so that with less number of people you can achieve efficiencies and you can pass on that savings to your providers.
Yeah,
So
absolutely.
yes, I think this is the trend that we are seeing. Lot of people are adopting, including ourselves, and I think this is the way industry is going towards. How do we reduce the manual work across the entire RCM processes so that we can automate, we can get better results, we can get maximum payments?
Yeah, absolutely. It just makes you kind of like super employees or like a super business when you have this automation in place so you can focus more on growth rather than spending too much time doing things manually. So 100%
Absolutely.
makes sense. And then like what are you doing specifically like within your own business operationally? Are there things that you're automating? Because we always talk about AI in here. Are there things that you're setting up already?
Yes, absolutely. That's a great question. And John, I will be very happy to state that we just finished one portion of our automation recently,
Excellent.
which is like simply getting authorization. So there is,
Mm.
and now more and more payer needs authorization for more and more services, right? Of
Yeah.
course, HM always needed one, but now even PPO plans needing authorization. So we have a cardiologist whose practice is we have to get authorization for every office visit, every echo, stress echo, nuclear stress test, and whatnot. So now we just put in automation in place where the actions that my team was taking could be done by a robotics process of RPA basically,
Mm.
where the script runs, they enter the script essentially puts in the values from your system
Yeah.
and you get an authorization result out, whether it's processed, not processed, approved, not approved, or it needs more medical records. But yes, so we are moving in that direction and trying to see what can be done as we move forward.
Yeah, it sounds like it's kind of like I've heard like RTE or real time eligibility. It's kind of the same
Mhm.
concept, right? Yeah.
Absolutely. And to your point, a lot of software vendors are already doing the real-time eligibility. So that has already been like now almost 100% of the softwares provide real-time eligibility. So now it is going to further step down. How do we automate other processes within
Yeah.
RCM?
Yeah, absolutely. And are there like pain points in your operations today outside of like, it sounds like you got eligibility figured out, you kind of started automating that. Is there anything else specific that your company runs into?
Yes, absolutely. I think with the changing landscape, there are every now and then we have something new that we come across. Specifically, now the one of the biggest, I wouldn't say challenge, but one of the biggest change we are seeing is requirements for medical records, right? Earlier, there weren't that many services that needed medical records. Now we see that almost every service, like a lot of the service, and that also depends on the payer, like United Healthcare
Yeah.
asking for medical record for every other service that you provide, right? And looking at the providers and their busy schedules, many providers are behind in closing their charts and, completing things. So what we are seeing is request for medical records, request for authorizations, strict timely filing limit. I mean, these are some of the challenges that we see on an ongoing basis, and it's getting tighter and tighter every year.
Yeah. It sounds like a kind of like a multitude of different things happening at the same time that's compounding. So absolutely. And then like, are there any parts of like your workflow, that you wish just kind of ran smoother when working with these specialty healthcare practices as you engage with them and kind of go through the process?
Yes, there are areas we always feel that wish could go smoothly or would help provider themselves a lot. And that is the time when patient walks into the clinic, right? I
Mm.
mean, making sure that they have patients accurate ID information, or in fact, not just ID, but they have verified the eligibility for the patient upfront and identified what
Yeah.
is copay, their co-insurance, what's their unmet deductible, right? Especially in the beginning of the year, the months of Jan, Feb, March, April, patients have very high deductible, right? So checking if everything for a patient walking into your clinic is accurate or not. What is his or her balance as they walk in? And then collecting that money up front so that when your claim is processed, you already have collected patient responsibility. And this is one area where we constantly coach, guide
Yeah.
our practices to do better and better. But of course, it has its own challenges, but this is an area that needs to get better.
Yeah, absolutely. And then how are you, you know, how do you engage with these practices right now? Are you doing like manual outreaches or like referrals? Like, I'm just curious how that works from the billing services end.
So most of our growth for the last 13 years have been organic, mainly through referral and word of mouth.
Okay.
Once we start working with a practice, they love our work. They love the hand
Yeah.
holding. They love the guidance, and they love to see the collection that they are getting, right? I mean, clean accounts receivables, good cash flow. I mean, these are the simple things that, helps them not just use our services, but they tend to refer us to their friends and family members. I mean, people, especially small practices, are owned by one physician, two physician, or three physicians, and they talk to each other. And yes, referral is the main source of our business growth.
That's excellent. And you've been in it for a long time, so you got a pretty good network there, which is great. Well, then getting kind of like more like metrics, because I'm an analyst, that's how I think. What's working really well for you right now? And then like what's also been harder than expected?
Working well for us in terms of overall, we are able to, like I said, we are able to collect well for the known services
Yeah.
and, things anytime that you have a new edition of the codes like G2211. That was a new addition to the E&M service that we just saw it last year. Now, collection of the regular E&M services is going well. However, anytime there is an industry change or any change from CMS year over year, what we find challenging is that sometimes some payer pay, some don't pay, and it becomes a trial and error to work with them on how to get paid on this new services that comes out. There is a budget neutrality with CMS. So if they are adding a new code, of course, there is going to be a reduction for existing E&M. And based on that, some of the services gets paid well, some don't. So especially the newer services, we always find it challenging, but it's a good problem to have. If there is something new out there, you will have to work hard, learn more, and then see how you can solve it.
Yeah, absolutely. It's a constantly changing industry, and it's probably extremely difficult to keep up. You almost have to check things daily or a couple times a day just to make sure you're keeping up with everything that's happening. Yeah. And are there any like metrics or KPIs you're using today to kind of measure how you're growing over time, or just curious if you've looked at those things?
Yes. So key KPIs that we use in this business is collections. What percentage of claims are we collecting in the first 0 to 30 days, 30 to
Yeah.
60 days, 60 to 90, and 90 to 120? And like I said, 50% of our claims get paid within 0 to 30 days,
Yeah.
approximately. Then more than, like, I would say about 80%, 50 to 80% is what gets collected between 30 to 60. The remaining, and then what as a team we strive for is no more than 10% beyond 90 days, and beyond 120 days, no more than 2%. So that's what we strive for, is almost 98% of the claim payments within 120 days maximum. You may ask me, John, why not 100? But 100 is always there will be 1 or 2% cases. And again, that goes back to that medical necessity portion of it, where no matter what you do, some payers will not pay you
Will not
in
pay.
that 1 or 2% of the cases.
Are those typically like the appeals that go to the payer? They usually take like months. I've heard about these scenarios. So they may take several appeals or, take a long time.
Yes, in fact, those appeals, you are absolutely right, takes months, first level appeal, second level appeal, third level appeal, and still won't go through. There are handful of cases that go to that stage.
And if you were to solve like all your big blockers today, what does success look like in 6 to 12 months? I know you've been in the business for a while, but like, what are you looking at down the road to accomplish?
Well, that's a great question. Any practice that we take over, we always feel that it takes about 6 months to streamline any office processes. And once you streamline that office end-to-end processes by the time a patient walks into your clinic till the patient walks out, if you have streamlined everything within your office, each and every practice in this nation can collect 98% claims. And that's what we strive for. So as we take on any practice, I tell them, you work with us, we work with you, we make changes, and we can show you the results.
Excellent. I love that data too. You're striving for 98% by the end of 120 days. So that's a very realistic statistic, and you've obviously been able to show that, which is amazing. And then, is there anything you guys need to figure out soon but haven't had time to tackle yet in your business, or things you're working on?
Again, going back to AI, there are so many pieces that we can automate within this business, which will save us cost and in turn save cost to our providers, right? A lot of manual processes can be optimized or enhanced with AI. And I think that is the goal that we have as we look into the future. Sooner than later, we want to identify and automate the processes that we are doing manually so that we can pass on those savings to our providers.
Absolutely. Maybe even get to like 99%, like, even just like one more percentage, that's pretty darn close. So absolutely. Yeah. And thank you for joining us on the podcast today. I really appreciate your time. It's been a great conversation. Where can our audience find you online?
So there is our website, which is www.zenservices.net, LinkedIn as well, and Instagram as well.
Excellent. Well, thank you, Binta. I really appreciate your time, and I learned a lot about the billing and coding industry and who you serve. So thank you so much.
Thank you, John. It was wonderful speaking with you.
You as well. Thank you.
Bye.